Good morning, everyone, and thank you for coming to our press conference today. My name is Jamie Peddle. I am from Brampton. I am a founding member of the Canadian Autism Treatment for Medicare Coalition, and you can find us on our coalition page on Facebook. We are here today to call on the provincial government to stop dragging their heels with respect to the revamping of the Ontario Autism Program and to quickly move to implement reforms that would improve access to autism treatment for the tens of thousands of children with autism who have been on unconscionable waiting lists. I am a single father of 4 children. The youngest is an 11-year-old boy who was diagnosed with autism when he was a little boy and who is severely affected by the disorder. Like so many other children in Ontario who have autism, he needs medically necessary autism treatment. The treatment is intensive behavior intervention therapy based on principles of applied behavior analysis known as ABA. The medical and scientific communities have known since the 1980s that ABA is effective evidence-based treatment for autism. Repeated studies over the past 40 years have demonstrated that early intervention treatment helps children with autism develop to their potential and that as many half can be integrated into the school system and function at the average level. Applied behavior analysis treatment for autism is evidence-based and is the core healthcare need of children with autism. It is an investment that reduces support costs over their lifetime. Until the cause and cure of autism are discovered or a more effective treatment is found, ABA is the core healthcare need of children diagnosed with autism. Over the years, many provinces have launched ABA autism treatment programs. Ontario's program was launched in 2000. However, the program was not treated as medically necessary health service to be delivered through the Ministry of Health with OHIP coverage. Instead, the ABA autism treatment program was assigned to the Ministry of Social Services. This is a fundamental error in public administration and program delivery. The department that administers welfare does not have the healthcare expertise or the resources to do the job. Since inception, the Ontario program has been plagued with unconscionable waiting lists. The Public Health Agency of Canada issued a report in 2019 indicating that the prevalence rate of autism was 1 in 50. Just last month, the American Centers for Disease Control issued a report stating that the prevalence rate is now 1 in 36. More and more kids are going to be added to the wait list that will continue to get longer unless something is done. The American Psychiatric Association's Manual of Disorders refers to autism as autism spectrum disorder. It is a neurological disorder and its treatment is a health issue. Yet, the Medicare system in Ontario discriminates against newly diagnosed children with autism as their treatment is not covered by the Ontario Health Insurance Plan. Because ABA is not covered by Medicare, the cost of providing medically necessary treatment has often fallen to the parents who are forced to resort to the private sector. The consequences are that many of our children are not receiving treatment because of their family's inability to pay. This is not only un-Canadian, it is immoral. Children with autism should be able to access treatment using an OHIP card and not their parents' credit card. We are calling on the Ontario government to end the discrimination against autistic children by implementing 2 steps. Number 1, transfer the Ontario Autism Program to the Ministry of Health. It is critical that the responsibility for Ontario's Autism Treatment Program be moved to the Ministry of Health from the Ministry of Community and Social Services. Autism is a neurological disorder. Autism treatment is a health issue, not a social service issue. Number 2, have OHIP cover the cost of the Ontario Autism Program. Cost of autism treatment in Ontario should be covered by OHIP. All other healthcare services are covered by OHIP, pursuant to the principles enshrined in the Canada Health Act. There is no reason why ABA treatment for autism, whether provided by direct service or direct funding, should be excluded from Medicare coverage. The Ministry of Community Social Service has delivered the OAP by contracting it out to the regional service providers. In Eastern Ontario, the provider is the Children's Hospital of Eastern Ontario, known as CHEO. The argument that the Canada Health Act and Medicare should only apply to services provided by a doctor or a hospital, and that autism treatment is not delivered by either, is clearly false. There is no reason why autism treatment cannot be delivered through a medical facility. To those who say it can't be done, consider the current existing healthcare system of rehabilitation services delivering, which can be used as a model for the delivery of autism treatment through healthcare with Medicare coverage. The Ontario Health Insurance Plan covers the cost of inpatient rehabilitation care. Rehabilitation that takes place in an outpatient clinic, the home, or the community may be covered by OHIP. Such rehabilitation healthcare services typically involve one or more members of a rehabilitation team consisting of psychologists, physiotherapists, occupational therapists, speech therapists, social workers, and nutritionists. Why can't we add board-certified behavior analysis who are specialized in autism treatment to the mix? The current shell game in Ontario deprives children with autism from OHIP coverage for their treatment. One of the advantages of transferring the OAP to the Ministry of Health is that federal funds to help pay for the program would be available from the Canada Health Transfer and any additional health accords that may be renegotiated in the future. Recently, a wave of dissatisfaction with the provincial autism treatment programs has resulted in increasing calls for the federal government to work with the provinces to develop a national autism strategy. A key component of any such strategy should be the inclusion of autism treatment under Medicare, and provinces should use the opportunity to negotiate a funding formula with the federal government. It has done so for other health issues, including mental health, so why not autism? At the same time, the government of Ontario should join with other provinces and the federal government to develop national service standards for autism treatment delivery. Over the years, many families have migrated from Ontario to other provinces and to the United States in search of improved access to treatment. This is an embarrassing and shameful disgrace. The raising of common standards of healthcare delivery is in our interest and would put an end to autism migration. Premier Ford, you can make these two things happen. You will prevent more families like mine from having to empty their bank accounts, get second and third jobs, sell their valuables, remortgage their homes, face bankruptcy to pay for autism treatment for their children. You will also save many marriages that will otherwise end in divorce from the stress. We need Medicare for autism now. Thanks. And I'll take any questions if anybody has any, or you can also contact us through our coalition on Facebook. Going once, going twice, sold. Good. Thank you. Thanks.